I'll give you a quick overview about Tyto Care, about our company, about our product, and a brief description about our existing market presence. So just as a background, Taito is a telehealth company. We are providing a full telehealth solution. I will not go into the numbers here in the slide, but you know, especially after COVID, telehealth is everywhere. Everyone are talking about it, everyone need it, and everyone use it now. But the question is whether it's efficient as a real physical visit. And one comment relating to Germany, we see now also governments supporting telehealth, changing the regulation, changing the reimbursement, and easing the data security. So it's not just a trend driven by the providers and the patients, but also driven by governments that understand the potential, understand the value, and understand the need and promote it. But if you look at telehealth, and when I'm talking telehealth, I'm focusing more on primary care. So today, when people are saying telehealth or telemedicine or teleconsultation, usually what they are referring is to what everyone is familiar with, a phone call or a video call. But eventually, using just a phone or just a video is very limited when compared that what you as a patient get or what you as a doctor can provide in a clinic. And those limitations, this lack of capabilities in the virtual world eventually leads to a lack of trust. And this lack of trust reducing the utilization, the adoption, and eventually it creates some disappointment by both the doctors and the providers and the patients. So that's where Taito is coming. The Taito is trying to bridge the gap between the virtual world and the physical world by providing a set or a kit of connected devices that basically replicate the clinic experience by providing a medical grade FDA and CE cleared medical devices that basically enables the physical exam. And we see that by having those tool of devices that augments or enhances the virtual consult together with a trusted provider, we really see a much higher utilization, much higher adoption, and reducing the cost and the visit associated. So just regarding the device, what Taito is the core functionality of the Taito. There are about 4 devices that enables 8 examinations. We have a digital stethoscope for heart, lungs, or abdominal auscultation and measuring heart rate. We have an otoscope to look at the ears. We have an examination camera with a tongue depressor to look at the throat, skin camera, and a non-contact forehead thermometer. Everything, of course, is CE cleared and as a medical device. But beyond the devices, because Taito's examination are very unique, okay, it's not like a simple blood pressure or temperature reading or a glucometer where you press a button and you get a number, that's it. Taito's examination are qualitative examination, requires some skill, some knowledge, and this is why usually those examinations are done by physicians, by nurses, or any professional trained user. But in order to allow anyone to do those examinations, not just professional users, we have the Taito platform that is featuring a lot of AI capabilities and a lot of guidance and navigation features to help the patient to do it home alone, potentially with the help of the doctor, if he's doing a live consultation, or offline asynchronous with the guidance of the app. So it's a full telemedicine solution, including video conferencing, doctor, patient app, and an API to the health record. And of course, it's fully secured in terms of GDPR compliant, everything is encrypted, all data is in Europe, so we are aware of all data security and privacy requirements. In addition, with some of our customers, we are doing integration, really to streamline the process and the workflows. So I mentioned we're supporting basically 2 modes of operation. One would be a live examination as part of a video call, and another one is more asynchronous, where the patient is guided by the app with our AI that both tells you which examinations to do based on symptoms collected by the user. But more importantly, once you are doing the exams, like putting it in your ear, is that what you see here? Once you put it in your ear, so beyond the app helping you with Academy and teaches you what to do, it will provide you guidance and feedback. So once you insert it into the ear, the app and the device will guide you in the canal and even identify the eardrum. So you as a patient, which usually are not familiar with eardrums, you will know you've done it correctly. And not less importantly, we need to verify that when this data, which is collected, gets to the physician, he will be able to achieve a diagnosis. Okay, we don't want to collect garbage. So this is why the AI is so important. Also here to identify the tonsils, to verify the needed image, the needed anatomy was captured, and same goes for a stethoscope. So also here, because it involves sounds, so we provide live feedback, live guidance on the quality of the sound being collected. You see the green indication here, meaning the algorithms are identifying breathing sounds or heart sounds in a good quality that will allow a diagnosis. And if not, it will alert you and notify you how to improve the exam. So in addition to the asynchronous mode, we have a full a live examination where we use a mobile app by the patient and a doctor app. What you see here is the doctor app now. So from the doctor side, he's conducting a video consult, a video call with the patient using the Taito platform. In the right-hand side, you see the device in this mode is under remote control. So once the stethoscope is being placed on the chest, live sound is streamed from the stethoscope, so the doctor can use his headphones to listen to the lung sounds, heart sounds, and identify murmurs or wheezing or other abnormalities in the chest, in the heart or lungs. And we provide, you saw the points, we provide a very seamless, a very intuitive experience for both the doctor and the user. And it's very, it's not like bundling and integrating a lot of devices into another platform with a lot of complexities and different user interface. It's a very holistic approach, a very intuitive user experience for the doctor. And it's very important because eventually we need to provide confidence to the physician, because eventually Taito's target is not just to give initial consult, but really provide the full treatment, full cycle, really to save the visits and give the prescription and the full treatment. So in order to do that, we need to provide confidence for the physician that they are not guessing, they are not making mistakes. We need to give them, okay, I see the image, I see the eardrum, I listen to the sound, and I can take a decision whether this patient needs antibiotics or some other drug, or maybe rule out other or pneumonia or some ear infections. So you can see a common list about our chronic conditions or primary condition, but of course, we are not limited to this list. In terms of product lines, I will not go into details, but you see Taito solution, we have Taito Home or Taito Pro, depending on the use case, but you see Taito can be relevant to many, many use cases. So some of our customers using Taito Home, more with their members, with their patients at home, or there are customers using Taito Pro more for care homes, elderly care, nursing homes, schools, etc. So in terms of market presence, so basically Taito is already quite scattered around the world. We are active in more than 30 countries already. But as you see from the map, most of our customers are in the US. We have started at the US about 4 years ago, and already almost 150 health organizations and health insurance companies using Taito, each one in different use cases. But also in Europe, we've started our footprint about 2 years ago. You see some of our customer base. So in Europe, we work with Switzerland already in a large scale with Suica. Suica is a big insurer, health insurer in Switzerland that offers Taito Home already with thousands of devices. AXA, we work with them in France with their telemedicine provider Care as part of pharmacies. Discovery in South Africa also launched Taito Home, Anthem in the US. So we have a lot of customers also with the NHS in the UK. So we are working with a lot of health system and health insurance all around Europe. These are just numbers, again, showing that Taito is, although still in Germany, we have done only pilots, but in other places in the world, we are quite deployed on a large scale. And I think that I will end with a quick video, just showing you eventually the real life experience of Taito. So this is a video done by Sheba Medical Center, which is the largest hospital in Israel and one of the top 10 in the world. This is for COVID. This panel is related to COVID. So Sheba, regular COVID patients with mild symptoms, they send them dash with a pulse oximeter and a thermometer. But when they have a patient who are a little bit more complicated cases or at risk, but still they think they do not need to be hospitalized and capture a bed, they give them in addition a Taito. Okay, so the doctor can do more examination, can get more confidence that even though they've sent those COVID patients to the home, they still can rule out any infections or deterioration in the patient's condition. So you can see the experience. So the doctor is doing a video call. I muted it because it's in Hebrew, but you can see the subtitles. He's doing a video call and see the patient, can connect to the device, select the relevant exam, guide the patients. Also for the elder patients who are not very technologically savvy, the doctor can help them. So basically, they're doing it together. So the doctor can measure temperature, can look at the throat. You see, so when the device is placed in the throat, the doctor see in real time exactly what he's doing, and listen to the lungs. You see, you can tell them, please place the stethoscope on the chest, listen to the lungs, rule out any wheezing or infection, and know whether the patient is safe or maybe there is some deterioration in the condition, and bring him back to the hospital. So this is just to give you a notion, what does it mean to do a Taito visit in real life? Here in this example with COVID patients. And of course, it's not only in Israel. We have this in a hospital in Switzerland called Fribourg, and hospital in Italy, and more examples. I hope you enjoyed it and it was helpful. Thank you. Dankeschön.